Okay, yeah, sorry about that. How deep is deep palpation? And what am I feeling for? What's the difference in the light versus the deep? What am I feeling for? Pardon? Deep is organs, so I'm feeling for organs or deep types of tenderness. What about the light? What am I feeling for there? Well, the deep you would palpate and feel masses. The light is the skin structure and the muscle structure. So you can tell a lot about muscle tone, the skin if it's dry or there's rashes with the light palpation. With the deep palpation, you're going to feel those masses, organomegaly, or tenderness as well. So you speak about that when you're palpating. And then also what we ask for is assessing for the liver border during palpation. That's not something I think we've demonstrated. So let me show you how that goes. So with the liver border, what we have the patient do, and this is something you want to practice on each other as well, the liver is on the right upper side under the rib. So we want to let the patient know that we're going to have them take a very deep breath in, and you're going to put your hand up under that area where the liver is, and you're going to try to feel that liver edge, which many times you can. You feel if it's enlarged or bumpy. Usually it's a very smooth feeling. Okay, Mr. Jones, take a deep breath, and I push up in there, and I barely feel that liver edge. It's nice and smooth. Relax. So we can practice it on each other. So you want to kind of push up under there when they take a deep breath and try to feel that liver on the right side. So this is a technique that you want to be sure you know how to do, because if they have an enlarged liver, then we can assess for that, and at that time we can do something about it. Also, if the liver is enlarged, it could be a sign of fluid overload. So you could have enlarged liver because it's diseased from alcohol or drugs or medications, or they could have an enlarged liver due to overflow of fluids, extra fluids. So also we want to percuss, and this is through the extra points that you can get is the percussion across all four quads. And here, what am I listening for? Dullness or tympany. And when we demonstrate the percussion on the chest, what will we be listening for there? Percussion on the chest would be resonance, either hypo or hyper, depending on if they're trapping air or not. So when you do those percussion, you want to try to understand what it is you're listening for too. All right, so now if we look at the patient, we want to do the urinary portion while we're in the abdominal area. The rest of it, we might have to have the patient sit up so we can do the posterior back. So I would say to the patient, now what I'm going to do is check for your kidneys. So we're going to do this duckbill technique where we're going to go about the 10th vertebrae down, and it's going to be just about where you're going to see your kidneys are going to be back in here. So we're doing this technique approximately in that area. So we're going to have this patient hold still while I do this duckbill. I don't feel that kidney, and that's a good sign, because an enlarged kidney would be something that we would be worried about. In most cases, you're not going to be able to feel these kidneys, but you would do it on both sides, assessing the right and left side. Also, since we're thinking urinary, then what we want to do is then, I've done the percussion, so I could percuss down to the bladder, and I'm hearing a tympany. What do you guys think? Is it full or empty? Empty. Full, because it's like a drum full out, so there's fluid in it, it's full. If it were empty, it would be shut, you know, the tissues kind of collapse against each other, so it will make a dull sound. So this is more a hollow sound. So I'm thinking she's got to urinate, and we have to help this patient if they have retention. All right, and then the lymph nodes are also in the groin while I'm down here, so I'm going to be palpating the lymph nodes. And what else do I palpate down here? The femoral arteries. So I think we've caught everything that we need to do while they're laying down. We would defer the rectal exam, but we would indicate that we would be checking the rectal area for redness, drainage, hemorrhoids, you know, cleanliness, and so we always bring that into the head-to-toe assessment, even though it's not really conducted. You just talk about it, so it's something you think about, though. Okay. All right, so I think we've got it to the point where we've assessed everything. Did I miss anything other than I'm going to demonstrate the fremitus and percussion on Mr. Bones? Any questions over this so far? Okay, so let me bring Mr. Bones over and I'll, yes, go ahead.
If somebody carries a lot of weight in their front, when you're doing the bladder, does it sound any different?
With the percussion,
Yeah.
you pull the belly back to then do the percussion below the symphysis pubis, because otherwise, you know, the adipose tissue can superimpose itself onto that. Maybe a little bit more difficult to assess because they're still going to have adipose tissue right over the bladder. That's a good question. With our heavier patients, it is harder to assess for masses, tenderness, and to do percussion and to hear the sounds, you know, as clearly. Good question. Okay, let me bring Mr. Bones over and I'll demonstrate the percussion and fremitus for you.